Hi, my name is Barbie Enrico, and I'm here to welcome you to Pitch Tips Zoomcast, and where venture capitalist Fred Haney gives feedback to CEOs of startup companies to help them raise capital. Fred is an experienced venture capital fund manager, angel investor, entrepreneur, founder Money Club, and author of The Fundable Startup, one of the best-selling books about startup companies getting funded. So let's find out what Fred has to say to today's CEO.
Hi, and welcome to the Pitch Tips Zoomcast. I'm Fred Haney, your host. The idea here is that you get to be a fly on the wall as a budding entrepreneur pitches his company to a venture capitalist. That would be me. And the idea is to observe the dynamics, see the kinds of questions I ask. In this case, my purpose is not to decide whether to invest. My purpose is to help our CEO improve his chances of getting funded as much as possible. So we're going to try and sharpen up his PowerPoint and improve the chances of getting a check when he goes to give his pitch to either angel investors or venture capitalists. I'm here because I've spent over 50 years working with hundreds of companies. I've had a lot of good results, about 60 exits. My background includes venture capital, angel investing, and helping start a handful of startups myself. Our guest today is Jeff Lucas. Jeff is the CEO of Vital eCare. Jeff, why don't we give you a chance to introduce yourself briefly, give a little personal introduction, and then give us your little elevator speech about what Vital eCare is about.
Well, perfect, Fred. Well, thank you for the opportunity to speak with you. A little bit of my background, actually graduated from UC Berkeley a few years ago. Right out of college, I went to work for IBM. That's where I had the opportunity to cut my teeth in healthcare. My career is about 35, 40 years. Most of those years have been in healthcare. I've had the opportunity to meet some great people along the way, and some of those people I've actually reached out to, and they're joining me in the effort of Vital eCare. Now, Vital eCare, as you'll see through the presentation, is a vision that I've had for a long time after doing work with Kaiser and starting Oracle's healthcare and other companies where I've been involved with innovative solutions in healthcare, mostly on the clinical side. But Vital eCare was a vision I've had, and it's now today the time is right to launch it, which is to really enable patients, families, everybody along that patient's care continuum to be sharing their health information and aggregating even greater levels of health information, because where we need to go is to utilize today's technology to help an industry that's not been totally disrupted yet, but to sort of pave the way to disrupt and transform into where care can be a better proposition for everybody, and we all win.
So you have a lot of background in the, I don't know if it's the software side, but the sort of systems development, customer solutions side of things at IBM. That's kind of what you learn at IBM.
Yeah.
You're bringing that to bear on this problem, I guess.
Right. And I've also had, solutions, applications development experience with a number of early stage companies, startups, corporate America, Oracle, et cetera, to where my focus has always been looking at big problems and finding ways where technology, which is what I learned at IBM, how to bring solutions to that using information systems technology, all the way starting from mainframes and developing solutions on mainframes all the way to today, the cloud. The cloud enables such great technology. So now thinking of aggressive visions like Vital eCare, we can actually make that happen. And that's what we're doing. We're taking a very challenging industry where we are putting forth a very aggressive vision. And the way we like to think about it on our team is we know where the industry is going. And if you remember the great Wayne Gretzky, is they asked him how he is so good at hockey. He says, I always skate to where the puck is going to be. And that's exactly what you'll see in Vital eCare. We have a vision of we are going to where the puck is going to be. Where everybody else is skating to the puck, we're going to go, we're going to meet the puck where it's going to be. And that is in 2030 and sooner, to be able to help this national, global, crisis of healthcare costs getting totally out of range.
Yeah, I love the analogy. It makes me think of a football quarterback. I love watching some of these really good quarterbacks. They do, like you say, they're not throwing the ball to where the receiver is. They're throwing it to where he needs to be when he catches it.
Exactly.
And
And you just have to have that
I
ability.
was a quarterback for a while.
Well, so was I. So Fred.
Good analogy. Well, look, my book, the Fundable Startup, which I can never get my point is sitting here. The title is The Fundable Startup, How Disruptive Companies Attract Capital. And the point is that there are really two important dimensions that the VCs are looking for. They're looking for a big disruptive idea that solves a very important problem. And it sounds to me like you've got that. They're also looking for management, people who they believe are going to be able to pull it off. And you've got a lot of great management experience. So I think what we're looking to do here is bring those two things together, a good idea, good management background, and convince somebody that they need to write you a few big checks.
Yeah. Well, and thanks for that, Fred. And the way I look at it is the team. I mean, you look at the team I brought together, they're some of the best folks I've worked with. All of them are much smarter than me. They've all been in innovation. And I think that team over the past year has helped to detail these requirements, file a patent, plan out the roadmap. We're so ready. We've de-risked this thing to the point where now, the way I feel about it, Fred, is we're going to give somebody out there that has the money an opportunity to put that money in a really good place to move it toward solving a large challenge. And if they like to be part of a company that's going to be a household brand in about 5 years, this is it.
Sounds good. So Jeff, let's go ahead and do your screen share.
Okay.
And go through your slides. I will, I'll comment a little bit. If I have a comment on a specific slide, I'll jump in, but I'll try and sort of hold my fire until you get all the way through and come back at the end.
Okay, great. So, well, what I want to do in the next 10, 15 minutes, and then we'll take questions along the way or answer them at the end. But we really want to position who we are, what the problem is we're solving, how we solve it, how we succeed, the team, and then the overall opportunity. So Vital eCare is a game-changing startup digital health company. We're pre-revenue. We've got a strong leadership team, and we have a very strong vision that we're driving to. The innovation that we're building, that we've designed and now building, is a patent pending digital platform that really helps to a patient and a family bring into a digital world that they can have their secured personal health information. And if you're a patient with multiple diseases, you know the challenge of bringing all that information into one secure place.
And Jeff, my main comment here would be, you're making me read a lot. If your audience is reading, they're probably not hearing what you're saying.
Yeah.
So I would bulletize this a little more.
Perfect. Okay. Well, let me make the bullets here. It's an aggregation of personal health information combined in the cloud set of microservices, a collaboration engine that anybody who would be involved in providing care insights and helping with the care plan can be part of that. A care management tool to actually take all these disparate care plans, which is a key challenge, to bring them into one person-centered care plan that people can participate in. And then a knowledge engine that actually can deliver insights to the patient and the family and the providers based on the information it's collecting on that patient. Now, this isn't necessarily the problem we're focused on. This is actually a statement about the unsustainability of our healthcare environment, which currently it's 4.1 trillion spend. It's projected to be 6.2 in 2028. The core challenge in that is all of the chronic diseases. Chronic diseases happens as we age. And there are many people that are predisposed to it. So those numbers are growing. 70% of deaths are due to chronic disease. But the projection now is 71 million people by 2030 that'll be over 65. So that just tells us we're headed toward, if it's a challenge now and the costs are challenging now, it's going to be greater. But the real problems are the escalating costs, the fact that we can't get health information at any point in care, even where the patient lives, works, and plays. The families aren't engaged in an environment that's seamless. I mean, they are there to help, but it's a big challenge to try and coordinate everybody. And the multiple providers even have a tough time, taking care of a diabetic patient, for example, who sees about 6 to 7 specialists, sharing information about that patient. But really, the problem is, the good news is we've done a lot to spend money on making the patient journey inside a clinic really solid, and we're continuing to do that. But that's not really where care starts. It starts there, but the time the patient leaves the clinic is really when the challenge happens. And that is going home, telling your family what the issues are, what we need to do, what did the doctor say, change the diet with no specific, and all those things are the challenge. Because that is where we have an innovative approach to sort of dissolve all that, bring into a very accessible cloud-based environment, a seamless experience where information is surrounding the patient wherever they are, with connection to the people that are going to help care, with a plan to go get their diet, rest, exercise, activity, and seeing all these specialists, to where now they can see the improvement in their care through the coordination of all resources. So in reality, we've got a platform, which will be a platform as a service. We can address chronic disease. We can help people in their wellness planning or fitness or high performance planning. And it really brings in all these resources. This is a depiction of what I stated up front. We've got this personal health aggregation that we call SPHERE, which is Secured Personal Health Electronic Resources. And we've trademarked that. It shows all of the information all the way through the genomic data that we can capture for a patient. But then it's really connecting it to a collaboration engine, which identifies all the people, all the personas that are involved in a patient's care, what's your primary care, your endocrinologist, your care navigators, your family members will have, every patient will have a proxy so they can do and access everything the patient can to support them. And then we've got a unique and innovative approach to care planning. And that is what we call DREAMS. And that stands for diet, rest, exercise, activity, lifestyle, medication, and specialists. These are all the components or the domains of considering what a patient must do to reach wellness and sustain a healthy, satisfying life. So it gets into the specifics of helping the collaborative, the team of people help that patient decide the diet and create a plan, the rest and create a plan, and then to measure all this on a daily basis, right? So here's the architecture that will be in the cloud. It will be a microservices focused. It'll give the providers, the insurers, the health plans, the patients, the families, and communities a way in one platform to be involved in, from a provider, determining your care, delivering that to your Vital eCare profile, where your family can now get involved, where even people in the community that are there to provide services, could be a YMCA, could be your pharmacy, and they now can all be tied into helping deliver what the patient needs, right? Plus, the way that we're architecting this in the cloud makes it accessible. We can deliver this to an enterprise. We could do it, behind the wall of a Kaiser, for example, or we can have this just fully hosted. Also, we can partner with companies to provide some of the utilities in Vital eCare that would help their platform better serve their clients. And we've talked to a number of medical device companies and other platforms where they see this potential. Okay. Now let's step back and look at what this market, the size of this market. It's tremendously large, where there are more people now wanting to invest in or wanting to seek starting companies in this domain, where information is really the key to future innovation and how we structure and deliver solutions in that. So Gartner Group sees the growth of cloud-based remote patient monitoring as growing to 116 billion by 2025. So we are a bit of each of these silos. And so our aggregate SAM we see is about $10 billion. It's probably greater, but wanted to be a bit conservative on that. Now, when we look at the competition, we've studied over 100 companies that are in this space of virtual patient engagement, we call it, right? And we've used sources like Gartner Group and Markets and Market. And we've also used KLAS. So KLAS, if you look over on the left, they've stated what key requirements are for the future or where the puck is going to be, based on interviews from leaders in industry, the providers, the insurers, the self-employed or the self-insured employers. And so we just took those requirements and said, okay, this is it. These are actually requirements we're delivering to. And as we look across the top, we see some of the vendors we've picked as either the EMR vendors like Epic or MyChart, Athenia Health, and their inability to really move their architecture into these areas are going to challenge them. The ones that are more cloud-based like us, they've got some really, really innovative solutions out there. BeWell, for example, started in 2016. It's a great company having great success. They've raised over $74 million, and they're on the run. And we're a few years behind them, but we're going to enter this market because it's huge, and we've got some differentiators here. We're going to press forward, and we're going to take our share of this market. So in the analysis that Gartner Group did, and it basically said, this is an emerging market. There's no leader. There's no one that has a full vision. We think we do. And of course, the EMR vendors are not going to be able to really solve this whole challenge. But what Gartner Group did tell their readers, and these are big health delivery organizations, insurers, they said, because of COVID, it really introduced that we need to have more virtual ways to care for patients, right? And they said, but it's here to stay now, folks. So you better either invest or partner to put this plan in your future, to have some level of a virtual patient engagement. We think Vital eCare is that answer. We believe, I firmly believe, that we're going to get a number of conversations with some of these big organizations that haven't quite decided where they want to go. They're going to see our vision and they're going to want to partner. They're going to want to invest in us. So, and we will be able to use them as further refining how this rolls out, making sure every step of the way we're meeting the metrics that we want to meet. This just gives you an idea of the number of HMOs and IPAs and ACOs that are out there. And one of the things you see over in the lower left corner is this value-based care. Value-based care is driving the industry. It's driving the industry because Medicare and Medicaid are the two largest payers in industry, and they are edicting through policy to providers that they must comply with value-based care, which is to say that when you're delivering a hip replacement, you're going to get a fixed fee for that. And a hip replacement requires afterwards to go to therapy, et cetera, and you're going to get one price to take that money, spread it across the partnerships you have with the PT and everyone else, because if something happens and that patient comes back to have it redone, that is on you. So that's a very important concept for industry to grasp. Now you look at the way we're going to go deliver our solution and make money. First of all, we're going to focus on providers signing up, and they'll foot the bill, but we're going to give them some utility in here where they're going to make money. They're going to make money by using the tools we're going to build, which is remote patient monitoring, that if they have a patient that is a Medicare patient and has multiple diseases, diabetes, hypertension, heart disease, they will put them on a program where they will monitor their blood pressure, their A1Cs, and a few other things we've identified. Now, with the patients having the ability to record all that with Vital eCare and have the family support that, we're going to get greater compliance. We're going to have more patients that are going to be doing this. And the providers at the end of that month can bill Medicare, $92 a month per patient. Times that by 1,000 patients they may have. That's a good deal of money. That's an additional revenue to the practice. So that'll pull them in, and then we'll just have our programs help bring families into understanding. We're going to deliver a solution that's easy to adopt, easy to understand, user-friendly, has to be able to be adopted by low-tech users and high-tech users. And we have a ton of features in there planned out that will be enable all of them to participate together. Future fees are going to be, when we introduce it, roll out to family and friends, or families rather, where they can use it just to manage their own health going forward and pay a certain amount a month, or pay an annual fee and get a reduced price. Also to have, platform licenses. I mentioned a few companies that I've already talked to about partnering or having them license some of our technology to use in their solution. White label, let's say a Kaiser wanted to use this, we'd be happy to license it to them and let it be, under their Kaiser label, custom development, and a number of other things. So we've got a really, I think, a rich future of opportunity, because the problem, as we've stated before, is large. And if we can get the traction, if we can deliver to the metrics, we can define our path. Phase one, again, we're going to be looking at insurers. We're going to focus on what are called accountable care organizations. And those are organizations, there's a good 700 of them, that they are integrating multiple delivery organizations in their community to abide by this value-based care. And they're basically funded by Medicare. Phase two will push to get enterprise licenses. There are a number of large enterprises out there, Kaiser being one. We've got relationships there, so this is something we believe they'd be interested in. and then direct to consumer, and then consumer services. Consumer services meaning that, I mentioned dreams, diet, for example. We could have dietitians that could sign up to be Vitally Care service providers and that have families identify them and be able to engage them, be able to, do that through a service that we get a certain amount of that fee as part of having them hosted. This is the team. And I mentioned before I give you my background, but Dixie Baker to the right, she is one of the, she's internationally known in the work she's done. She's right now working on international genomics. So she was part of Obama's healthcare committee. And her and I worked together at SAIC where we were working on integrating Kaiser's 12 regions, which is where we met Tim Sullivan, one of our advisors. Anghal Orentia is our COO. He's also legal counsel, and he and I are the only two board members at this time. Dr. David Sklar is a person I worked with at iKnowMed. Very fortunate to have him on board, and basically it was a year ago that he saw something about what I was doing, wanted to talk, and within the 15 minutes he said, "How can I be part of this?" And that's typically a reaction we get from lots of folks. And then Margaret Chapman, her and I have known each other for 30 years. We've worked at a few different companies together. Incredibly talented on the whole clinical information, the engagement of patients and providers, and she's going to head up that part of our organization. And then we've got Dave Seltzer, who's our Chief Financial Officer. So in our financial projections, this is probably pretty conservative with the opportunity in this market, but it's something that we can identify as achievable market or achievable targets. We have the detail on the use of funds. Primarily, our funds will be of the 2 million, about 1.2 will go toward the development. And we've just signed up a company that has extensive experience in building and delivering healthcare solutions in the US. And it's a company called StableX, and we just identified them as the vendor we're going to go with. So we think they're going to get us there quickly with all the experience they have in building enterprise capable solutions, and our in-house CTO, Ranga Serhavolman, who's working full time, but he's our CTO and is really designing our architecture. Between the two of them, their organization and Ranga, we're going to build a highly scalable, secured environment. So this is just we can take a look at the things we've done in the past to de-risk this, and be happy to share with anybody all the details of what we've done, the patent, the roadmap, the details, the planning, where we see our first pilots coming from, in the milestones and plan we have from this point going forward, where we want to deliver our first, call it MVP, or our pilot in the September-October timeframe. And I think by the time we get there, we'll have a full solution with the engagement of those pilots, early adopters, we'll call them, helping us make sure we're designing and building what will work for patients, providers, insurers, et cetera. So it's pretty exciting. And the one thing I didn't mention is that we do have Morgan Lewis, who is our patent firm. They're the ones that I went to about 3 years ago to broach the idea. The partner there, who has some healthcare background, really saw our opportunity. They're the ones that filed our patent. They're the ones that are provisional. They're going to, the first part of the money we're going to get will go to filing that patent and getting it, as well as building out a portfolio. So, the investment opportunity of $2 million, We've already, as a team, it's probably now upwards of 300K have put into this project. We haven't taken on any other money. We don't have any debt. We have a strong team. We have multiple trademarks. We've got, our early focus is to get the fundraising going to get enough to start the project. This vendor I mentioned, Stablix, they're willing to go without the money. They are so excited about this project. And then, we believe that we're going to have, with this $2 million, we're going to get our first commercial licenses. We'll be generating some level of revenue. We'll be proving a product with the metrics being met. We'll have the ability to sort of brand this and get it out to the marketplace. And, with the people on our team, and I believe that this year, as we get going, I'll start bringing on people that will be leading our sales effort and bringing in clients. And until that point, I'd say I'm probably one of the best at getting that done, because I've negotiated a lot of contracts. I love getting out there, talking and sharing this vision and engaging an enterprise to go with us, which is really what we want to do. And then I believe that we're going to be ready sometime in the 2024 timeframe to bring on a Series A. And it'll be that venture partner who's going to step up and help us carry it the rest of the way. So for those early adopters, I would say, Fred, this is one of those opportunities where whatever level of money you want to put in now, by the time we convert, I think you're going to get more than get your money back. So that's pretty much what I'd like to share, and look forward to any questions you might have.
Okay, good job. Jeff, why don't you leave your screen share up?
Okay.
And we'll talk about a few slides. We'll go back through. I didn't want to interrupt a whole lot. Why don't you go back to slide 1? Oh, okay.
Oh, this one.
Yes.
Okay. Bullets.
And let me get to the right page in my notes. So our company statement, you're making me read a lot, but that's okay. I don't mind reading that. But that seems to me to be sort of about the company. I'm not sure it tells me exactly what the company does.
Okay.
I mean, how in a sentence or two, how would you say what the company does?
So what the company does, Vital eCare, develops innovative digital health solutions for industry.
So let's say a little more about what you mean by digital health, and for whom.
So Vital eCare is really focused on delivering within our product vision solutions that help address the care, coordination, and collaboration for providers, families, insurers, and community.
Yeah,
In a way that we help reduce costs, help improve quality, help improve patient satisfaction and quality of life for all.
So let's jump to the next slide. I think is the next one, the one that describes this one talks about the problem you're addressing. And I think the next one also talks about the problem, doesn't it?
Right. This is just really a setup,
Yeah.
So I mean, people mostly know that it's healthcare costs are up, and they have personal experience. But here's really the problem: the disconnected nature of patients when they're in their community dealing with their chronic disease, not having the right information at the right time.
I think one of the challenges I have as you go through your presentation, and there are several slides where this kind of comes up as an issue. It's not entirely clear to me exactly who is the customer. You know, who's lying awake at night wishing they had this, you know, what's the problem that's eating at them that you're solving? So is it the patient? Is it the end user?
It's everybody, Fred, that's to the left of the box in red. Okay, it's the patient, it's the parent, the sibling, the child, the relative dealing with the patient. It's all the things they need to do to help improve their health status. And it gets to be a very complicated, we've all had it.
Yeah.
You know, we've dealt with somebody in the family or a friend that's going through a disease.
Well,
So many things they need to do.
Yeah,
it really turns their life upside down.
I understand. So I think that's a good statement, but I think you could be more clear about that, focus on that a little more. But
Okay.
then here's another question, because who's the customer? Who are you selling to?
The primary care provider.
Yeah, see, that's where it gets a little confusing. I think you need to sort that out very clearly. I mean, you're solving a problem for the patient, but it's the healthcare providers that you're pitching to.
Yes, it's
Do they perceive that there's a problem?
constituents. What's that?
Do they perceive that there's a problem? Is the healthcare provider?
Oh, yeah. Oh, absolutely. Oh, yeah, absolutely. Yeah. I mean, so if we look at this chart here, Fred, as I said, you know, the amount of money we've spent on the patient journey inside a clinic. Hey, when you go to the clinic, you feel good, feel like they understand you and, they got you. But then they say, all right, Fred, here's what you need to go do. And they give you a care plan, and they go see a specialist and they give you a care plan, because we're dealing with a few diseases here, but nobody's looking at the whole Fred. And you're taking these bits and pieces and you're going home, and your wife or somebody says, so what did the doctor say? Well, change my diet. Okay, well, what does that mean? Well, I don't know. I've got this disease. Well, then we go do research. We go involve the children. We go, then we got to figure out, okay, how do we like take all these different things we're being told to do and put them in a plan, an actionable plan that we can work on every day.
Yeah. So well, I think that's important.
Are not available. But here, Fred, the reason why providers want this, because they realize when a patient leaves, they have no visibility. They don't know if the patient's going to be accountable or compliant, because that's how they're going to get better. And if they don't do that, the only time they're going to know is the next time they come into the emergency room or into the clinic and they see things are way off track.
Yeah, so I think what you just said there, Jeff, is real key to this. I mean, that's really important. I think you might want two threads here. You might want to say, look, we're solving a problem for two constituency groups.
Okay.
Patients have a problem because their families, nobody knows what's going on. Nobody knows who's involved. Nobody knows how to follow up. That nobody knows who their primary physician is. There's all this record keeping and stuff that's hidden away in somebody's file and nobody knows how to get at it. So they've got a problem that needs to be solved. But the healthcare providers also have a problem. Right. The healthcare providers have the problem that they have no way of following up after the patient leaves.
Right.
So I think it would help if you made that separation, because later on, you're going to tell me the guys who are going to pay the bills here are the healthcare providers. They're the guys you're going to go, they're your customer.
Yep.
They're the guys you're going to go sell to. So in a way, they're the people we're most worried about, in the sense that they're the guys who are going to put the money up.
Right.
But it is, but you got kind of two problems here, and your solution works for both in slightly different ways. I mean,
Right.
for the healthcare providers, you're providing a way to follow up and stay in touch. For the patient and family and relatives and friends, you're providing a way to stay connected.
Right.
So go back, let's go back
And I'll throw one other in there, Fred, because the
Sure.
insurance, just because remember, somebody pays
Sure.
and it's the insurer. So that's a good point. Go back.
Yeah, let's. Oh, on this one, your headline there is U.S. healthcare is unsustainable. I mean, I don't think that's quite, it's not healthcare that's unsustainable. It's the cost, right? The growth in cost. Hey, we just can't keep doing that.
Well, honestly, Fred, it's unsustainable.
Well,
Because-
maybe.
No, we have a projected shortage of primary care. They're getting burnout. It's just, it's a system that is every day, looking toward a catastrophe. So something has to break.
So help me. So it's unsustainable because.
Because we can't keep having the number of patients that are becoming diseased growing, the costs and limits of what's out there. The fact is, there's a projected shortage of primary care physicians by about 46,000 in a few years. So all the things that are in place trying to help, tackle this, they're getting out of control.
Yeah. So you just gave me a pretty good answer, but that doesn't jump off the page here. I mean, I look at that page and I'm not sure I know how to read it to come away thinking, well, Jeff's
Okay.
right. Healthcare is
Well,
unsustainable.
we could change this to whatever, but the facts are what I just said.
Okay, and I think those are good facts. I think what you want this slide to say is healthcare is unsustainable because,
Right.
what are the 4 or 5 reasons? And I have a feeling they're here, but not in a form that I know how to interpret.
Okay. All right. Seems like just really kind of just restructuring
Some
the.
bullets or some wordsmithing or something.
That's easy. That's easy to do.
Okay, let's see. Let's go to the next. We kind of talked about that. And then the next is your solution, I think. Next one. So here, I think you want to be very clear somehow about how you're solving the problem that the patient has, and also how you're solving the problem that the providers have. This may allow you to talk to that. Does this do that for you? Does it let you explain that?
I mean, it doesn't detail it out. No, it's what I would talk to. Yes. But really, and I was gonna take this one out and just jump to this.
Yeah, this one, I just thought there was a lot of material. You might break that into 2 slides, because there's an awful lot there to digest. But you do a good job at talking through it.
Okay, we could do
It's
that.
just a lot of
Yeah.
material for the audience. Let's see, is this the one where we talk about? So let's go to the next one. Yeah, I think that was okay. We may have gone past it. Somewhere you used an abbreviation, RMP.
Yeah, remote patient monitoring, RPM.
That might be back. It was on a market slide, I think.
Oh, I think right here,
Oh,
remote patient
RMP,
monitoring.
RMP software in the upper right there.
Yeah.
I don't know what that means. You know, that needs some explanation. I would be careful about jargon and abbreviations because most of the people you pitch this to are not going to understand the jargon and the abbreviations.
Right. Okay.
I would spell them out probably.
But we do spell it out at the bottom here.
Okay, but
But yeah, I got you.
I wasn't smart enough to figure that out.
Got it.
Let's see. I thought your coverage of the competition was good. That worked pretty well. Oh, but and then maybe is it the next slide that has the Gartner Group material?
Yes.
Yeah, that's a lot for me to read. Again, if I'm reading, I'm probably not hearing you talk.
Right.
So I would probably bulletize the Gartner Group stuff, you know, summarize it down, boil it down to 3 or 4 bullets if you can, something like that.
Okay. Got it.
Don't want your audience sitting there having to read paragraphs while you're trying to talk to them.
Right.
And let's see. Then next slide. Here again, you got a lot of abbreviations. And I just wasn't sure what those meant.
Okay.
I mean, I guess I could kind of deduce. I mean, when I see HMO and PPO, I kind of figure out what the context is.
Yeah. Well, you know, the interesting thing
sounds an awful lot like beer.
Yeah. Well, you know, the only interesting thing here, Fred, is every November, we all are forced to look at, you know, do you want to stay with your HMO or do you want to do an IPA? Because our health plan options and enrollment always puts these out in front of us.
Yeah.
So I think at some level, you know, even in the household, these are kind of, oh, okay, I got it. It's Kaiser, or I want to go with Blue Shield or whatever.
But well, you either need to, I don't think you want to explain each of those as you go. I would spell them out probably.
Okay. Well, then people are reading.
Yeah. Well, if you don't spell them, I think you either need to either need to spell them out or explain them.
Okay. Well, I think there's a way to do it. Just health provider options.
That probably helps. That at least steers me.
Yeah.
In the right direction. Okay, let's go to the next one and the next one. I think my next comment might have been on 17. And just that there's a lot of information there.
Yeah. I mean, I wouldn't necessarily use this. This would be for a next level discussion, I think.
I think it's a really good point. I mean, one of the strongest arguments you can make for a startup is, you know, the traction you've got in the marketplace, the progress you've made so far. Yeah, maybe I wasn't the CEO of IBM, but look, I've been able to pull off all this stuff in a short period of time. But it's part of your argument that you can make things happen here.
Right.
I think there's value in it. I would probably just try and triage the points a little bit, maybe knock 3 or 4 of them out and maybe shorten the bullets or something like that. But
Okay,
I think it's a good slide
okay, we can do it. We can do that.
and a good message to be sending. See, and then let's see, I may have got ahead of myself. Let's try a look at 16. Is that the one where you give the revenue forecast? Yeah.
Yes.
So you're talking about 30 million in 2016. Most investors are going to want you to go out 5 years on your forecast. And it turns out that that 5th year is probably pretty important because the 30 million number in 2026, it would probably not be too exciting. At least the VCs might be okay for angel investors.
Yeah, because see, we're not going after the VC right now.
Yeah, and
By
it's
the
okay.
time we get there, we will.
And it might be okay for angel investors,
Yeah.
but they're going to want to see the 5th year, I think. I would add 2027.
Okay, well, then that's 6 years here because we're still in 2022 and we're going to generate some revenue.
Yeah, well, you're right. And that's probably okay. Well, and I think you're right that with those kind of numbers, you're probably aimed at angel type investors, which is fine.
Yeah, we are absolutely not talking to VC. We've already talked to some. They said, this is great, keep us posted, but we don't do this early.
Yeah. Well, that's kind of shorthand. They'll do early if they're excited enough about it.
Well, yeah.
If that number was 100 million in 2026, the VCs might think about it. But I'm not suggesting that you change it. I mean, it is what it is. You know, it's what you can manage to.
Well, the VCs that would even look at this are actually, they probably have some investments in this arena.
They know the space. Yeah,
They know this space.
Yeah.
Those are the ones that have reached out to us.
Yeah.
Because they think it's pretty interesting.
Yeah, I wouldn't be surprised downstream if you get some VC interest.
Oh, I would totally agree with that. I think by the end of this year. But see, I want to do that, Fred, because I want to have them say, yes, listen, look, how do we position ourselves to be the firm you want to, go take to the Series A?
So let's look at 18, I think. Oh, maybe, I'm sorry, maybe go back to 17. Yeah, we already talked about that, didn't we?
Right.
Okay, so next one, 18. Planned milestones. Oh, my comment here was I would focus on things that you will have accomplished by such and such a date. So I would probably take out like the last one that says plan for expansion. You know, I would make this focus on hard accomplishments.
Okay.
Because those are the things that you're going to be selling when you go out to raise your Series A.
Yeah.
You know, look, we've done this and this and this and this, and nobody cares at that point if you've written a plan to do something. All they really care about is, what's in the bag. What have you actually accomplished?
Right.
So I think it's a great chart. There are just a couple things there that are kind of soft. I would focus on the hard accomplishments, like the product release plan. I'm not sure that helps a whole lot.
Mm-hmm.
But 3 implemented sites with a commercial version, that's great. I mean, that's a hard achievement.
Yeah. Right.
So I think those are the important things.
Okay.
Jeff, you really did a nice job since we first spoke of compressing down here and focusing the message. I think it'll make a great Monday Club presentation.
Oh, good, good. Thanks, Fred.
So good. I hope that helps you sort some things out. It's a good presentation. I think you got a good idea and a good execution plan and a good team there to pull it all off. Jeff, thank you for
Thank you, Fred.
for
Thank
doing a
you.
pitch tips.
Yeah, thanks for offering up all your experience. It's really validating. Thank you.
Good. Hope it helps. And
Well, it
audience, hope it helps you too. Be sure and tune in next time. We're doing a pitch tips every week or two on the Fundable Startup YouTube channel. If you haven't already subscribed, do subscribe. So you'll see the new ones as they come up. We're also posting some of the Monday Club presentations, and it's a good experience for you to see the kinds of questions presenters get and the kinds of things investors want to know about. I could point you to a fairly new website we put up, fredhaney.com. And if you look, scroll down the homepage there, you can find a link to a pitch deck template that we've put up there. That's a pretty good guide for how to put one of these together. So we'll say goodbye. Jeff, thank you.
Thank you,
And
Fred.
audience, come see us again next time. Thanks.
Okay. Look forward to the follow-up, Fred. Thank you.